This is our agent from Baton Rouge with Wright and Percy. This is Claude Jarrow, and he's gonna and this is Lisa, his assistant. And today they're gonna explain to us our new health insurance and dental. Go ahead, Claude.
And also with me is the representative from United Healthcare, which is the carrier we're changing the medical insurance to. And she's just a ghost right now. There she is.
Hello. The party can start now.
This is Joe J. Miller with United Healthcare, and Michelle Humphreys with United Healthcare. So they'll be assisting us also later on in the program. Okay, I'm going to use this little, you have two packages. I want you to get to this little booklet here that says John and John. And the other package, when Jane gets up, she's going to go with some special provisions and benefits that you have with United Healthcare. Okay? So if you open it up to the first page, on the inside, there's a carrier contact information page. You may want to keep this in your vehicle, on your desk, your wallet, whatever. We give you this information because I know some of you are truck drivers and on the road a lot. So if ever you need to contact one of the providers that are providing you with coverage, whether it's the medical insurance, dental insurance, or vision insurance, vision is going to be offered this year. That's a new benefit. You have their web address and their phone number where you can contact them from anywhere that you may be at the time. Also, we have listed Roberta, who I think y'all mainly go to when y'all need something to do with the medical insurance or any of the benefits. And the last person listed there is the one you need to call the most is Lisa Jones, which is in my office. And you can contact her at any time to get any information you may need help with. Next page is the announcement that this is annual enrollment. The reason why we do it as an announcement is because most of the benefits that are offered to you qualify under Section 125 of the IRS. What Section 125 of the IRS says is that we will help you buy certain benefits. And the way that the IRS helps you buy certain benefits is that they'll let you pay for that benefit without any taxes on that amount of money that you earn, kind of like your retirement plan, okay? A short example that I normally do, let's say your paycheck is $500. Let's say we're not doing the pre-tax right now, okay? And your medical insurance is $100. Okay, when the employer writes you a check for $500, they say, well, first we got to pay the state government, which is 2.3%. We have to pay the federal government, which is whatever tax bracket you're in, which the minimum tax bracket is 10%, federal tax bracket. And then we have to pay Social Security and Medicare, which is 7.65%. So about 20 cents on every dollar that you earn goes to the various governments in the form of taxes. So your employer takes that out, says, well, 20% of 500 is 100. So now I'm going to write the employee a net check for $400. Then they take that $100, send it to the various governments for you, and you get your check for $400. Or let's say you do have the medical insurance, your premium is $100. Then they take the $100 out of that if it was post-tax. Now pre-tax, I'm just doing an example, and then you get a net check of $300. When it's pre-tax, they're going to take the $100 out first. So now you're going to pay taxes on $400, okay? So 20% of $400 is $80. So you save $20 in taxes, right? So it's like the $20 helps you pay for some of the benefits that you're buying. Because you would have to send that money to the government anyway, right? Everybody with me? So the three benefits that you can pre-tax is medical insurance, dental insurance, and vision insurance. Okay? So that would come out of your check first before they calculate the taxes. So let the government help you with that. And the reason why I went through all of that, within the IRS regulations, it says, okay, because we're going to let you do this, once you elect that benefit, you have to maintain that benefit for a 12-month period. You cannot say 6 months from now, I just can't afford this insurance anymore. I want to drop it. can't do that. The IRS says you ought to maintain that benefit for a 12-month period. Now, you can drop the coverage, but you still have to take the premium out of your check because you're doing the pre-tax, okay? But should you have a family status change, the IRS has some rules in there that says, should something change within your family status, like if you get married, or if you get divorced, or if you have a child, or you have a death of a child, or a spouse, changes in employment, work hours reduced, all those are qualified events, so don't panic on that and think that you just locked in for this no matter what happens down the road. If your employer says, listen, I'm sorry, work is slow, you're only going to be working 30 hours a week now, or 27 and a half hours a week, whatever the number may be, that would qualify then where you can make a change, okay? So I just wanted you to know all the facts there. Any questions on that? Okay, and at the very bottom, due to healthcare reform, we're definitely going to need a medical form completed by all of you, even if you don't want medical insurance. We have to have your signature saying you're declining coverage. Because as you know, within the healthcare reform law, it says that every American citizen will have health insurance or they will pay a tax, or I call it a penalty, they call it a tax, to the government, for all those that do not have health insurance. So when you file your taxes, if you cannot prove that you have medical insurance, you're going to have to pay an additional tax to the government. Next page is the two medical plans. All right, children. Oh, I forgot you recorded that. Gee, there's somebody better looking than me if they're recording this. My goodness, why you didn't do this, Lisa?
You're better at it.
Not that you're better looking, but I mean,
I'm used to it.
He giveth and he taketh away.
okay, the two plans, and again, the company did receive a substantial rate increase in Blue Cross. So we went out to the marketplace for John & John, and United Healthcare was selected to replace Blue Cross. It is still a rate increase to the company. It was not like a rate reduction by making that switch, but it wasn't as great of a rate increase to John & John as the Blue Cross rates were. So with that said, John & John has made a decision not to change your costs whatsoever, even though there is a rate adjustment to them. So whatever you're paying now for your coverage, if you enroll in the same coverage with United Healthcare, that's going to be the same premium to you, or the same cost to you for the medical insurance. So make sure when you see your employer to thank him, because they are absorbing an entire rate increase. And I got to tell you, with healthcare reform, the way rates are going, employers are doing reductions on their contribution limits more than they are doing leaving them the same. And in addition to that, they barely change your benefits. Actually, some of your benefits improved by moving to United Healthcare, and we'll go over those. So, for y'all, it was pretty much a win-win for you, the employee. So make sure you tell them a big thank you when you see them. Okay, the two plans on the left-hand side is, and we kind of got them almost combined, but they should split right in the middle there. The left-hand side is the PPO plan, and the right-hand side is the HSA plan. Well, it's called up there the balance, but I'll get someone to correct that for next year. So we'll go over the two plans kind of side by side because there's no difference in the cost to you, the employee. So under the PPO plan, you have an annual deductible of $2,000. Under the HSA plan, the deductible would be $1,500. And for a family, the PPO would be $4,000, and family, of course, on the high plan would be $3,000. Under the $2,000 deductible plan, once you hit the deductible, United Healthcare will pay 70% of covered medical expenses, and you would be responsible for 30% until you've paid a maximum out of pocket of $4,000. Okay? Now, in the Blue Cross plan, that was similar to this last year, which had the same deductible, the maximum out of pocket was $6,250. So your max out of pocket has been reduced with the change to United Healthcare. What does the maximum out of pocket represent? If your claim is $1 million or $10 million, it doesn't matter. This plan says once you've paid a maximum of $6,250 out of pocket, no, I'm sorry, under this plan, $4,000 out of pocket, which includes your deductible amount, United Healthcare in-network will pay 100% for the remainder of the year. So in other words, that's the most a medical illness that is all expenses covered by the carrier that you can pay. The other plan on the right side, the $1,500, after $1,500 it pays 80%. You're responsible for 20% till you've met the same maximum out of pocket of $4,000. Back to the PPO side, it has co-pays when you have an office visit. Here's where you're going to see the big difference in the two plans. The high deductible plan doesn't have any co-pays until after you hit your deductible. Under the PPO plan, the $2,000 plan, when you have a doctor's office visit, you go to a primary care doctor, you're only going to pay a $40 copay. When you see a specialist, you're going to pay a $55 copay. The high plan, you have the first meet. Huh? 80, I'm sorry. I got 55 written down because the plan y'all had before with Blue Cross was 40 and 55, so that is a small increase on the specialist side with the change to United Healthcare. The other plan is going to be straight 80% other than prescription drugs once you hit your deductible, so we'll just stay on the PPO side. With both plans, wellness and preventive care is covered at 100%. You don't even have a copayment to meet, okay? So when you go in and have your wellness exam, that is covered at 100%. Wellness. Let me tell you, a lot of times people are going and going for their annual physical, and while they're in there, the doc says, well, how things been going with you? Well, everything's been really good, except my knee's been bothering me. I've been having some stomach cramps. Whatever. If you say that, the doctor's going to investigate a little bit more, and when he sends that claim into United Healthcare, he's going to have a diagnosis code on there instead of a wellness exam code. And if that happens, then they're going to say, now you owe a copay. If it's true wellness, if you go in for your well woman exam, your well medical exam, and the doctor sends it in that way, you pay absolutely zero. Anything with a diagnosis, but just like if you went in for the flu or sinus infection or chest pains or whatever it might be, you went to a doctor, you're going to pay a copay, same thing. For emergency room, you have a $350 copay. That's another improvement over the Blue Cross plan. With Blue Cross, you had the first meet the deductible, and then it was, went to the co-insurance. So that's a reduction. Urgent care, if you go into urgent care in place of emergency care, you're going to save $250 because it's only a $100 copay. Before with Blue Cross, it was $55. Inpatient and outpatient surgery is covered at 70% after deductible. Prescription drug coverage, you have a separate $250 deductible for prescription drugs. Thereafter, you pay either $10, $30, or $60. Any questions?
Yes, I have a question.
Yes.
Let's say that I have an illness now, that it's an ongoing illness, or if someone's in the hospital and they're using Blue Cross now and they're still in the hospital after January 1, what happens?
As long as they're still in the hospital for that condition, they will stay under the claims will be processed under Blue Cross until they're discharged from the hospital. If they're just seeing a physician, January 1st, they become United Healthcare. Good memory, girl. Any other questions?
The HSA, it says the tier 1 $10 after the deductible. So what is the deductible that The 1,500?
the 1,500.
Okay, so it's not just.
Under the higher plan, it's pretty simple. You have a deductible, 1,500, then they pay 80% on everything. Afterwards, you pay 20%, except for prescription drugs. You pay to the 10 to 30 or the 60. Both plans the same out of pocket. In other words, car accident, bam, everybody's in intensive care, okay? The max out of pocket is $4,000 on both plans. So if you're gonna have something serious, or you got someone has a serious illness in your family, whether it's cancer, heart, diabetes, whatever, and they're running pretty high claims, both plans, the max out of pocket is $4,000 per individual.
But the difference, Claude, is that on the PPO, if you have 3 people in a car accident on the PPO, one person seriously injured, another 2 are not, on the PPO, 4,000 is the max that could be charged. On the HSA, 8,000 is the max that can be charged, because there is no single deductible or single out of pocket on the HSA. It's only the family deductible, family out of pocket that applies. But I think only one person's on the HSA, so the PPO is really what you guys have to focus on.
Yeah. In other words, the family deductible on the higher plan is different than the other. The other one is an individual deductible out of pocket per person, okay? But still capped for family.
Say that again?
The PPO, you have a deductible, say you're insuring your spouse has a deductible, okay? Under the high plan, under the
On the
PPO
PPO?
plan, once you hit on the PPO, once you hit your 2,000 deductible, United pays 70%, okay? And you pay 30% till you hit your out-of-pocket limit, which includes your deductible, which is another 2,000 out, then it pays 100%, okay? You and your spouse covered on the high plan. Once you hit the $1,500 deductible, it's still, because you got family coverage, you have to meet the family deductible first before it goes to 80%.
But you wouldn't need the family deductible on the PPO?
No, it's separated. Each person,
Each person has, so even though it says family deductible 4,000, it's individual.
you and your spouse, right. If you hit yours, you're gonna go into co-insurance, the 70%, okay? Under the high, you have to meet the 3,000, not the 1,500, if you have any coverage other than single. If you have coverage employee spouse, employee child, employee children.
Okay, but wait, hold on. This is what he's talking about. He's talking about this right here. This is 2 separate plans.
These are 2 separate plans.
Yes, and this
Yes.
is the high deductible that he's talking about, right, Claude? This is what he's talking about here.
But he's saying individual, he's saying
So
individual.
it's, but the deductible for the PPO for family is 4,000.
Right.
But
So let me explain it to you this
It
way.
is-
You
But
and
you're
your
saying
spouse are in a
2,000
car
per
wreck,
person.
and one person gets injured, the other one's fine.
what if you have
On
more
the
than 2
PPO,
people?
it's
Is
okay,
Doesn't
it's
matter.
okay. So on the PPO, you have 2 people, let's say you have 5 people in the car wreck, it doesn't matter. You have 5 people covered on the PPO. One person gets injured and it's $7,000 in claims, just for an even number. One person is gonna meet their 2,000 out of pocket, and then they're gonna pay 30% of the claims, whatever's left over, so 30% of 5,000, because 7,000 minus 2,000, 5,000, up to $4,000. Then you're done.
For that
If it-
person.
For that person. On the HSA, let's say the same thing, one person's injured, 5 people are in the car wreck, 7,000. You've got the 1,500, or actually, what's the family?
3,000.
You've got the $3,000 deductible up to 8,000. Even though it's only one person paying into it, 8,000 is what you're gonna have to meet on this, because there is no such thing as a single deductible or a single out-of-pocket. It
But
doesn't
then it's met
apply.
for the family for the
Then
year.
it's met for the family for the year.
On the
Right.
HSA.
On the HSA.
Why are you listing a family deductible of 4,000 on
Because you could have-
PPO?
If
But
two
then you have
people
just
were
one
injured.
person, yeah. You
If
could
2
have-
people were injured, then you would have you meet the family,
Right.
in her example that she just did.
Everybody has their own on the PPO, it's an aggregate on the HSA. So there's one big one on the HSA, there's individual ones on the PPO, but there is a final at the bottom that's for the whole family, that you could have 2,000 paid from one person, 1,500 paid from another person, 500 paid from another person. That way until the full deductible and out-of-pocket's met. Does that make sense?
Not really.
I don't know.
I'm just
I had a
confused,
dryer
it's
base.
confusing how you're saying
Well, it's,
a family deductible to me is more than one person.
It is, and you have on the
For-
PPO, you have several people paying into it.
it's
caps out
per
at
person
4,000.
till you hit the family under the PPO. The high deductible plan, if you have family coverage, everybody's claims, let's say you had 5 people, and you just having doctor visits and prescription drugs. Every dollar accumulates to that one family deductible.
Okay, I understand that.
On the PPO side, it accumulates by person, but it still has a max that you can have for a family.
One person can max out and kick into their 100% on the PPO.
Yes.
It's just confusing the way it says individual and family. You're thinking that a family deductible would be everyone, not necessarily each. There's
Yeah.
five family members.
Needs to be put in layman terms.
Yeah.
Deductible is for the family or for each person.
Yeah, okay.
Well,
I'm sorry,
it
maybe we're just not
depends.
understanding
Some
it.
people's got single coverage, so it's just an individual coverage. If you got more than one covered, then you move into family coverage, so.
Mhm.
That's why we have it as
Walking in
individual and
lumber.
family.
This isn't gonna show up.
That's okay.
Yeah.
That's okay.
Well, if you need more after, we'll explain it to you, yeah, okay?
It's, you gotta separate the two. You're looking at the two, I think, the same way. They're two different plans. One has what's called an aggregated deductible, which means all claims for everybody insured in that household accumulates to the one
To the one deductible.
deductible.
Family deductible,
The
family out of pocket.
PPO side, each person accumulates separately.
But they have a max family cap on it for you.
So what they're saying, if you have 3 in your family, actually if 2 hit the deductible and out of pocket, the third person that have a deductible or out of pocket.
Because the 2,000 twice has been met.
Exactly.
So on the PPO, if you have only one person hitting claims, then at 4,000, you're done. On the HSA, you have to get all the way to 8,000 to be done, even if it's just one person meeting it. Does that kind of clarify it a little bit for you?
I understand, yeah.
We want to make it clear because they're going to be sending this paper out, so others may have the same concern. So we don't mind the questions and we don't mind taking the time to get it where you understand. So if you're not clear, I mean, we'll continue. But it is confusing, I understand. I've been through it with my wife for several years. We own a house plan, so I understand where you're coming from. Okay, any more on that? Good, again, you don't see any rates down below. That's because your rates are remaining the same, whatever you were paying this year, 2014, will continue into 2015. The employer is picking up all of the increase for you, so that's again, a very, very good thing. Now I'm going to bring Jane up. She's going to go over some of the additional benefits with United Healthcare and go into a little bit more detail with that type of stuff. I do encourage each and every one of you to go online and register with United Healthcare, but she'll tell you why.
Thanks, Juan. Okay, so Juan said, my name is JoJanne Miller, and I am with United Healthcare. I've been with the company for almost 8 years, and I am in new business sales. And Michelle Humphreys is with us today, and she is going to be the account manager on this. We call her a strategic account executive, which means that she is going to handle the overall account management of the group, and she has a team under her that helps her as well. So I just wanted her to be a part of the meetings today. So we are thankful for your business. We're happy that you guys are coming on board with us January 1st. I think Claude had mentioned that we do want you to go ahead and get your prescriptions filled by December 31st. We are probably not going, in fact, I know we're not going to have you guys live January 1 because we're doing this so late in the month. We're going to have you effective for January 1, but it just may not be entered into the computer until after January 1, and then it'll go back to the January 1 effective date, and you'll have coverage for that. So any prescriptions, or if you have a doctor's visit in the first 2 weeks of January, go ahead and try to get those scheduled for the end of the month if possible. And if you have one that happens in the first 2 weeks and it cannot be changed, let us know. We'll call your doctor's office. We'll work something out with them. Okay? I don't want anybody to panic. All right, so if you guys will look in your packets, there is a booklet that says welcome. And it looks like this. This is going to be your guide to how to get the most out of your benefits. So if you'll open it up, you will see what your ID card is going to look like. And you'll notice on the second photo of your ID card, there's a code at the top of your ID card. That's so that most doctor's offices can swipe your card and see what your benefits are at that moment, how much of your deductible you've met, what they need to collect from you at that doctor's visit. If you flip on over to page 2, this is the portal that Claude was talking about earlier that you need to register at. It's not mandatory by any means, but in order to get the most out of your benefits, we highly encourage everybody to go out here. At this website, you can manage your prescriptions. You can type in a prescription name, and it's going to tell you what your costs will be based upon your benefits. You can look at alternatives to that drug. You can do a GPS search of providers in your area. You can see all of your claims, and you can actually data sort the claims on an Excel spreadsheet to see how many times the same provider filed the same claim. Because you may get something in from him that says you owe money, and you say, I thought that he filed this 3 months ago and it was paid. I don't understand what's going on. Well, you can look online and see what's happening. Was it reprocessed or something? You can also go out online and do a wellness program. So at the top of the page, of the front page on the far right side, you'll see something that says Health and Wellness tab. From there you can track your progress, so you can enter your cholesterol numbers, your blood pressure numbers, your weight. You can track your exercise regimen, things like that, so that in months, 3 or 4 months down the road, you can put the numbers in again and see where you were in the past. And you can do that for the next however many years, which is great information. You can also do something out here called a My Treatment Cost Estimator, which is really amazing. It takes your benefits and where you've met your deductible today, and you can plug in and say you want to have a knee replacement, you want to have a breast MRI, any kind of things like that that's on the drop-down tab. You can ask it how much it's going to cost, and it will say, if you want to have a knee replacement done by Dr. ABC down the road, he's going to charge you $3,700. Dr. XYZ, 2 miles down the road, is going to charge $2,100. It gives you down to the dollar as to how much they're going to charge you based upon how much of your deductible you've met today. Shows what their cost is and what your cost is going to be with your applied benefits. It'll also show the hospital, so it gives you the choices of the hospital, and you can drill all the way down so that you can have a true treatment plan and print it out. It'll also tell you online what to expect for surgeries, what to expect for recovery, things like that, and then also alternatives. So a knee replacement may be what you're asking about, but the computer may say an alternative to this might be physical therapy. Have you had physical therapy yet? So it's not telling you you have to have physical therapy. It's saying, have you thought about this to talk about to your doctor? Okay, so great information there as well. Once you're registered on myuhc.com, then you can go to the mobile app, which is called Health for Me, H-E-A-L-T-H for Me. This is on the Android and smartphones. It's a very simple app. It can track your numbers there. It has a wellness feature built in. You can look at your claims to date. You can look at an ID card to show the doctor's office in case you forget your ID card at home. It's on your phone. And it even gives you a place where you can tap where it says fax ID card to the doctor or email ID card to the doctor. So you can do it right there in front of the window. You can do a treatment cost estimator on your phone. You can look up by GPS an urgent care facility, emergency room, nearest doctor. So if you're traveling or you're out of state or anything, it's It's a great tool. And remember, we have a national network. There are no state lines with United Healthcare. So you get the same provider network if you're in California as what you get right here. Just call it up online. Okay? So these are the different things that you can do with technology. On the mobile app, there's also a place on there for a nurse hotline. So if it's 11:30 at night and you have 103 fever and you're not sure do you need to go to the emergency room or not, press the button and a nurse will call you back usually within 60 seconds. Tell them what your symptoms are, and then they can triage you right there over the phone to keep you from having to go to the emergency room at that point. If you keep on flipping through your packet, you will see instances of where to go or when to go to the doctor, urgent care, emergency room, so forth and so on. If you keep on going, you will see how to save some money at the doctor's office and estimate costs, how claims are paid, understanding your health statements. We're no longer sending out explanations of benefits on every single claim that's filed. We will send health e-statements once a quarter. So it'll show the different doctor's visits that you had in the last 3 months, but it's saving a little bit on the paper by not doing that. Keep on going through the health and wellness that we talked about. We have a pregnancy support system program. If you enroll in the pregnancy support, it will give you information. You can enroll all the way up to week 34, and it doesn't cost you anything extra. So it may give you a few perks by doing that. So you may want to call them and see what you can do with that. We have disease management, centers of excellence. Centers of excellence are used whenever you have transplants typically, or very serious medical conditions. And then we have the behavioral health as well if needed. If you guys want to go through, let's see, I think we have a specialty in here as well, a little bit of information. We do have a specialty program for you guys. If anyone is on a specialty drug, and specialty drugs are going to be drugs that are $500 or more for that one specific drug per month. If anybody is on that or has any questions, just let us know. We did have someone in the earlier meeting that had that. But this gives you information on how to enroll in that program. It's very simple to enroll, and then the drugs are going to be mailed to your home if anybody has that. Another thing that we wanted to hit on is the pharmacy, as Claude had said before, on the PPO, there's a separate $250 deductible that's not part of the medical deductible. It's a separate deductible that you have to meet on any pharmacy or any drugs that you get through that. Then the co-pays kick in. Our co-pay system is on a tier level. So we have tier 1 drugs, tier 2 drugs, and tier 3 drugs. It's not based on brand versus generic. So you may see some brand drugs that are in tier 1. You may see some generic drugs that are in tier 2. Okay? So it's based upon where that drug falls in our tier system.
And one thing to point out is if you're currently on any medications, double check, because you might pay a certain amount currently with Blue Cross versus our prescription tiered drug plan. So just double check. If it happens to be higher, there are alternatives in that category that you can talk to your doctor about to see if he or she is willing to, write you a new prescription for the lower alternative. But I'd like to point that out because that is a big difference between one carrier to the other, so that you're not shocked when you go to get that first prescription and say today you're paying a $10 copay and it jumps up to $30. So just, double check. You can go online, myuhc.com, and look at the prescription drug list. If it happens to be a higher, in a higher tier with us, again, just look at the alternatives. You can print it out or take the booklet to your doctor to have that discussion with him or her.
Good. Thanks, Georgianne.
Yeah, sure.
Did you want to explain about the Nexium, about the one you explained?
Yeah, one of the
purple
drugs.
pill.
Yeah.
One of the drugs that we discussed in the last meeting was that Nexium is not covered with United Healthcare. The cost of that drug is, I want to say it's approximately $280 a month for that purple pill versus the same drug, and whenever I say the same drug, I mean pharmacologically, the same components, does the same thing. The only difference is it's not covered in purple. is around $40. So we don't cover Nexium because we have an alternative that does the same thing, essentially. And we have several alternatives, it's not just one alternative.
And I've heard that the Nexium over-the-counter, people are saying it works
Mhm.
just as well. So that's
Yeah.
another alternative as well.
All right.
Thanks. Before I move on just a little bit, I mean, a couple of things is that, you know, if you're taking any medication now, again, please go and fill them by December 31st. Let Blue Cross pay the bill on that, process it through Blue Cross, because we're definitely not gonna have your ID cards in time. As soon as we get the account loaded, which Lisa's gonna be doing electronic, so that's gonna speed it up some, but you still probably be about middle of January. I mean, they're gonna rush it all they can for us over there. We was a little bit late this year, but John and John had some big decisions to make. They made some very good decisions. They didn't increase your rates, and they're giving you vision insurance. So fill those now if you can. In the event that you don't have your ID card in time, that you don't have any problems, you know, continue your medication. If you have to pay for it for some reason, you can get reimbursed, or the form, they'll either reimburse the pharmacy or reimburse you for the drug that you paid for.
Even if we don't have the cord, like for me, I have appointments the first week of January that I can't change. I'll have the information to give them when I go.
No, you need to see
Will I
me
have-
after, and let me
Okay.
call your doctor for you and let them know that you're switching over. And tell me which plan you're gonna have, the PPO or the, and I'll see if I can work
Okay.
something out.
But when I told her if she's seeing her OB doctor, they don't bill till delivery, so there's
Right,
nothing for them to bill
right.
United on her
So
monthly
if you've already
visit.
had your first co-payment charged with Blue Cross, chances are you don't owe anything until after delivery. And the reason they do that is because they don't know how you're gonna deliver. So it's gonna be one charge, or if you
Yeah.
have surgery, it's gonna be
Yeah,
a
well, I'm-
higher charge, and all the visits you have
Yeah,
side of
I
that.
had to meet with them and I'm paying right now.
Yeah.
But it's
Then you
not
should be fine,
actually,
she was
yeah.
ready, you should be fine.
It's only one entry per person. Thank you. Yeah.
Okay. Another thing, the app that Joanne talked about, I mean, especially if you're a truck driver, y'all going all over the United States, and that thing is unique. If you do the GPS thing, it will even tell you what the nearest network provider is, whether it's a doctor, an emergency room, or urgent care, or a hospital facility. So that app alone will keep you inside the network, which is where you get the most benefits. Because if you're outside the network, other than emergency care, you're gonna have probably some high cost dollars to look at. Okay, next we're gonna go over the dental plan.
Wait, I have a question. What
You already
happens,
allowed one question. I think you already raised your hand once.
I'm sorry.
Okay. Go
What
ahead.
happens if, like, my dependent is no longer, eligible for the insurance? Do I have to call and tell,
The 26-year-old?
right?
They come off automatically.
So
their
employees
birthday.
do not have to let anyone, they could just,
Well, they need to let you know for payroll deduction wise,
Right.
because, and that's listed in this booklet here, they're gonna come off automatically with
Okay.
United, but you're not gonna know unless it's, if they have other children, it's not gonna affect their payroll deduction,
right.
but if that's their only child on that's coming off, like in your situation, then you're gonna drop to employee spouse,
well, it's the same
well, it's the
price.
same price. But if it's somebody that has,
But even for COBRA reasons, they need
Right.
to notify you, because if they don't notify you, then that child misses his COBRA rights to
Right.
continue coverage.
So it is the employee's responsibility?
Absolutely.
Okay, I mean, I don't have to keep track of that.
Same thing with divorce.
Okay,
they're gonna come off automatically with United then.
okay.
But they usually tell you about divorce, they want to make sure
Yeah.
they get
Yeah,
her
'cause
off.
they-
Yeah.
Or she gets him off, one or the
Yeah,
other,
yeah.
right?
And also, if they get married, or if, they want to add a child, because they just had a child, they have 30 days.
That's
Yeah.
it,
30
we
days.
cannot exchange, like, we can't extend it. Yeah. There's no exceptions to that by law.
Okay. So,
30 days.
read it again.
You have to do it in 30 days.
or wait until the next open enrollment, which is at this time every year for January 1st.
Good questions, ma'am.
Michelle just brought up a good point. They can't register on the internet for myuhc.com until they're live in our system.
Yeah.
So whenever they get their temp ID cards, that's whenever they can go out there and register.
And you can use the same, if you register on myuhc.com, you can use the same username and password for the Health for Me app.
In fact, you have to.
Yeah.
That's how they match it up.
It's a unique system. We're insured with United Healthcare, so very familiar with it now. Took me a year, but I got it down pretty good. Okay, on page 6, the dental insurance is changing to Always Care. It was with Guardian Life. The benefits are pretty much remaining the same. There was a small adjustment in the rates, and of course the dental is voluntary. You pay the full cost of that if you enroll in a dental plan. The deductible staying the same. You have $50 annual deductible per person, maximum of 3 per family. So that would be $150 if you got 3 or more in your family. The benefit year maximum is $1,000 per person per calendar year. Preventive services, Class A services paid at 100% and deductible does not apply. So just like on the medical plan, you can have your dental preventive services done and it costs you 0. So on the medical side, you can go get your exam, healthy exam, pay 0. Dental side, same thing. Class B services, which is like in root canal, pull a tooth, extraction, stuff like that, is paid at 90%. And Class C, which is your major, which is your crowns and bridges, inlays and dentures, stuff like that, is paid at 60%. You also have orthodontic coverage for children up to age 19. That's a separate $1,000 lifetime maximum benefit that you have for your children. Again, you can see the premium cost below. You were paying $27.25 a month. That's a monthly premium, not a per paycheck. For employee-only coverage, it's going to $27.50. And if you had dependents, you were paying $77.23, and that's going to $80.76. Dental plan is all changing over to Always Care. It was with Guardian, so you have a new network there also. So you need to go to their site and check out the website. We have that for you on the first page for sure.
Your contact page.
Contact page, where you can go there to Always Care's site and check the network out. Any questions on the dental? Okay, next is the basic life insurance and accidental death insurance. Johnny John's going to continue to provide all employees that enroll in the medical plan with $25,000 of group life insurance, $25,000 accidental death insurance, which means if you die accidentally, it'll pay your benefit share a total of $50,000. That's nothing for you to do if you enrolled in the medical. You have the life insurance, unless you've had some type of status change. If you was married and your wife was a beneficiary and now you're divorced, you might want to do a new beneficiary form. Lisa Jones has those forms here with her today. She can change that for you, get that done. Next is the vision insurance. This is a new benefit. You have not had this benefit in the past. The very, very good part about the new benefit is that John & John has agreed to pay for every employee to have vision insurance. So for yourself, there is no cost. John & John is going to pay that premium you see listed there, the $4.85. If you want to cover your spouse, children, or spouse and children, the rates are below. There's a kind of a little boo-boo there. So especially those that's looking at it by video, what you need to do, if you wanted to insure your spouse, your cost is $485 minus the $919, because your cost is included with that spouse cost, but John & John is picking up your cost. So
I've got
you
to
would
figure
take-
out, it's $434 for spouse,
Okay,
$593 a month for just your children, and $1032 for the whole family. That's your cost per month.
that's per month, not per paycheck. Okay, and the benefits are, you're going for your exam, you're gonna pay a $10 copay. For your materials, you're gonna pay a $25 copay. You get standard lenses once every 12 months. Frames once every 24 months. And you can save for contact lenses, you have a benefit of $105 there. We will need you to complete an application to enroll at least yourself, because John and John is paying for that. And if you want to include your spouse and spouse or children, if you have those, you can do so. Questions on the vision? Page 8. Again, it's just a reminder that we need your forms in. We need a form on the medical insurance for sure from everyone, whether you're enrolling or not enrolling. And that has to be in to Roberta by December 23rd. And then we're going to rush it. And these ladies over here are very good about helping us rush the company by getting you ID cards. And they will, I think someone over here, maybe this lady here had a question. She will call the doctor's office and say, hey, I'm with United Healthcare. They're all effective for January the 1st. Here's a credit card if you need to bill somebody for right now. She's done that. She's given them a credit card. So she'll help you, so don't be alone. Okay, any other questions? Listen, I've got 3 beautiful ladies here waiting to help you fill out those forms. So if you want to do them right now, we would love it, and we'll pick them up from you. If you need to go home and discuss with your spouse.
Yeah, these are the 2 forms that need to be completed. In the John and John booklet, there's one form that says always care at the top. The other form's in your United packet. United, it says enrollment application at the top. Okay? These are the 2 forms that have to be returned to Roberta on every single person to elect or waive the coverage. So if you'll find these 2 forms, I'll explain what parts you do and do not have to fill out. Okay, y'all have the United Healthcare form out?